Have you ever woken up in the morning and felt a sharp stiffness in your lower back? A heavy, nagging pain that follows you throughout the day like an unwanted shadow? You sit for too long. It hurts. You stand up suddenly. It hurts. Even lying down does not always bring relief. What if I told you that this common pain, which millions of people silently suffer from every single day, can often be improved dramatically with just a few simple, gentle movements? And more importantly, what if the wrong exercises, done without proper understanding, are actually making your pain worse instead of better? My dear friends, as a doctor who has spent decades treating patients with back problems, from young office workers to elderly grandparents, I want you to understand one important truth. Lower back pain is not just a physical discomfort. It slowly steals your confidence, limits your movement, affects your sleep, and even impacts your mood and relationships. Many people start to believe that pain is now a permanent part of their life, but in many cases, this is not true. With the right knowledge, the right movements, and the right habits, your body has an incredible ability to heal and become stronger again. Let us first understand why lower back pain happens so commonly in today's world. Our lifestyle has changed dramatically. We sit more than we move. We bend incorrectly. We lift objects without using proper body mechanics. Our muscles become weak, tight, and imbalanced. When this happens, the delicate structures of the lower spine, the discs, joints, ligaments, and surrounding muscles begin to experience abnormal stress. Over time, this stress leads to inflammation, stiffness, muscle spasms, and sometimes nerve irritation. Many patients come to me with a common misconception. They believe complete rest will solve their back pain. They lie down for days, avoid movement, and become fearful of activity. Unfortunately, this often makes the condition worse. When you stop moving, your muscles weaken further, your joints become stiffer, blood circulation decreases, healing slows down. Gentle, correct movement is actually one of the most powerful natural medicines for your spine. This is where therapeutic exercises come in. Today, I will guide you through 5 simple but medically effective exercises that can help reduce lower back pain, improve flexibility, strengthen supportive muscles, and restore confidence in your movement. These are not aggressive gym workouts. These are controlled, mindful movements that respect the natural design of your spine. Let us begin with the first exercise, the pelvic tilt. This is a very gentle but highly effective movement. Many people do not realize that their lower back remains constantly arched due to prolonged sitting or poor posture. This arch increases pressure on the spinal joints. The pelvic tilt helps retrain your muscles to support the spine in a neutral, relaxed position. To perform this exercise, lie on your back with your knees bent and feet flat on the floor. Slowly tighten your abdominal muscles as if you are gently pulling your belly button toward your spine. At the same time, press your lower back softly into the floor. Hold this position for a few seconds, then relax. This movement may look small, but inside your body, important stabilizing muscles are being activated. With regular practice, this helps reduce strain on painful spinal structures. The second exercise is the knee-to-chest stretch. Many patients experience tightness in the lower back and hips due to long hours of sitting. This tightness pulls on the spine and contributes to discomfort. The knee-to-chest movement helps lengthen these muscles and improve circulation. While lying on your back, gently bring one knee toward your chest. Hold it with both hands and breathe slowly. You should feel a comfortable stretch in your lower back and hip region. Then switch sides. This exercise not only improves flexibility, but also sends calming signals to your nervous system, reducing muscle guarding and pain sensitivity. However, I must emphasize something very important here. Pain is not always a sign that you should stop moving completely, but sharp, severe, or worsening pain is a warning signal. Exercises must always be performed within a comfortable range. Healing happens through consistency, not force. Now let us talk about the third exercise. The cat-camel movement, a beautiful example of how controlled spinal motion can nourish the joints. Our spinal discs do not have a direct blood supply. They receive nutrients through movement. When you gently arch and round your back on your hands and knees, you are essentially pumping fresh nutrients into these discs. This improves hydration, reduces stiffness, and supports long-term spinal health. As you slowly round your back upward like a stretching cat, then gently dip it downward like a relaxed camel, you may feel a sense of relief and fluidity. Many of my patients describe this exercise as waking up their spine after years of stiffness. It reminds the body that movement can be safe again. But dear listeners, we are only halfway through this journey. There are still 2 powerful exercises left that can significantly change how your back feels and functions. More importantly, there are crucial medical insights about posture, muscle strength, and daily habits that determine whether your pain improves or quietly worsens over time. In the next part, I will reveal the remaining exercises that build real strength and stability in your lower back. I will also share simple doctor-recommended tips that can protect your spine during everyday activities like sitting, walking, lifting, and even sleeping. Because sometimes it is not just about doing the right exercise. It is about understanding how your entire lifestyle shapes your pain. Welcome back, my dear friends. In the first part, we began to gently reawaken the spine through movement, flexibility, and muscle awareness. Now it is time to move into the next stage of healing, building stability and confidence. Because while stretching relieves tension, strengthening protects your back from future injury. Let us now explore the 4th exercise, the bridge. This is one of my favorite doctor-recommended movements because it targets the gluteal muscles and the deep stabilizing muscles of the lower back. Many people with chronic back pain have weak glutes due to prolonged sitting. When these muscles are not doing their job, the lower spine is forced to carry extra load. Over time, this leads to fatigue, strain, and pain. To perform the bridge, lie on your back with knees bent and feet placed comfortably on the floor. Slowly press through your heels and lift your hips upward. Your shoulders remain relaxed, your neck stays neutral. Hold this position for a few seconds, then gently lower down. As simple as it looks, this movement trains your body to distribute weight more efficiently. It strengthens the natural support system of the spine, reducing mechanical stress on sensitive joints and discs. The 5th exercise is the bird dog, a powerful movement that improves coordination, balance, and spinal stability. This exercise teaches your body how to move the arms and legs while keeping the core muscles engaged. In daily life, we constantly reach, bend, and twist. If the stabilizing muscles are weak, these normal actions can trigger pain. The bird dog retrains your nervous system to protect your back during movement. Begin on your hands and knees. Slowly extend one arm forward and the opposite leg backward. Keep your back flat and your movements controlled. Hold briefly, then return and switch sides. This exercise may feel challenging at first, but with practice, it builds remarkable functional strength. Many patients notice improved posture and reduced episodes of sudden back pain after consistently performing this movement. Now, beyond these exercises, I want to share something even more important: how your daily habits influence your recovery. Healing the lower back is not just about what you do for 10 minutes a day. It is about how you sit, how you stand, how you sleep, and how you respond emotionally to pain. When sitting, try to keep your feet flat on the floor and your lower back supported. Avoid slouching forward for long periods. Every 30 to 40 minutes, gently stand up, stretch, or walk. This simple habit improves blood flow to spinal tissues and prevents stiffness. When lifting objects, always bend your knees and keep the load close to your body. Never twist suddenly while carrying weight. These small adjustments can prevent serious injury. Let us also talk about sleep. Many patients complain that their pain is worst in the morning. This often relates to poor sleeping posture. If you sleep on your back, placing a small pillow under your knees can reduce pressure on the lower spine. If you sleep on your side, a pillow between the knees helps maintain spinal alignment. These subtle changes allow muscles and ligaments to relax and recover overnight. Another powerful but often overlooked factor is fear. When people experience back pain, they begin to move cautiously, sometimes too cautiously. They avoid activity, worry about permanent damage, and unknowingly increase muscle tension. This fear can amplify pain signals in the brain. Gentle exercise, relaxation breathing, and gradual return to normal activity help break this cycle. Your spine is strong. It is designed to move. Trusting your body again is part of the healing process. Nutrition and hydration also play a supportive role. Adequate water intake helps maintain disc health, while a balanced diet rich in calcium, vitamin D, and protein supports muscle and bone strength. Excess body weight, especially around the abdomen, increases strain on the lower back. Even modest weight reduction can significantly reduce pain and improve mobility. My dear listeners, I want you to remember this deeply. Lower back pain is common, but living in constant suffering is not your destiny. Your body is not your enemy. It is asking for movement, strength, balance, and care. With patience and consistency, these simple exercises can gradually transform how you feel. Improvement may not happen overnight, but every gentle effort you make is an investment in your future comfort and independence. Think of your spine as the pillar of your life's activities, supporting your work, your family, your dreams. Protecting it is not just about avoiding pain, it is about preserving your freedom to move, to travel, to play with your children or grandchildren, and to enjoy the simple pleasures of daily living. So begin today. Start slowly. Listen to your body. Be consistent rather than intense. Celebrate small progress. And most importantly, believe in your ability to heal. Your health journey is not a race. It is a lifelong partnership with your own body, guided by wisdom, patience, and self-respect. Take care of your back, and it will take care of you for years to come.